Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, pre-health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Dr. Arun Srivatsa. Dr. Srivatsa completed his undergraduate training at St. Joseph's College in Bangalore, India. He graduated from Bangalore Medical College. He completed his internal medicine residency as well as his gastroenterology fellowship at the University of Rochester Medical Center in Rochester, New York. Dr. Srivatsa is board certified in internal medicine and board eligible in gastroenterology.
All right, good afternoon. Some familiar faces in the audience, and welcome to everybody. So today's talk is going to be about colon cancer prevention and treatment. So I don't have any disclosures that are worth mentioning. What we're going to talk about today are facts and figures about cancers, including colon cancer, some risk factors that would be pertinent, and how colon cancer would present, what symptoms it has, how one would treat colon cancer, and finally, most importantly, how one can screen and prevent colon cancer and treat this cancer. So in 2014, about 800,000 men and 800,000 women probably developed cancer. These are estimated new cancer cases in 2014. And as you can see on the left-hand side in men, we have prostate being the number one most common cancer. And on the right-hand side, you have breast cancer in women being the most common. Then as you go down the list, you see that lung cancer is the second most common in both men and women. And colon cancer, which includes rectal cancer, is the third most common cancer in both men and women. So that's an important statistic. Next slide shows you the estimated people who probably died of cancer in 2014. And again, the number 3 on that list is colon cancer. So while it's not the number 1, it certainly is up there, and it affects both men and women equally. So in 2014, there were about 96,000 cases, new cases of colon cancer, 40,000 cases of rectal cancer, causing about 50,000 deaths. The good news, if I started off on a dark and morbid note, the good news is that the death rate from colon cancer is steadily declining, which is good. And this is mostly attributed to improved treatment and also improved screening and prevention, which is the basis of today's talk. This is another graph that shows you how cancer incidence rates have changed over the years. And as you can see, prostate cancer really took off in the 90s, probably related to screening and the use of the PSA test. And as you look at colon cancer and lung cancer, those rates are actually reducing, partly because people have stopped smoking, they've probably improved their lifestyle, but also importantly, we're screening for these and picking up precancerous conditions and treating them, therefore reducing the incidence rates of cancer. This is among men. And the same thing holds true for women. You see the number 1 killer, the breast cancer, still up there. Lung cancer is still on its maybe way down because women, the smoking rates haven't really caught up as with men. So there are still a significant chunk of women who still smoke and haven't quit smoking yet. So the lung cancer rate still hasn't reduced as significantly as the previous slide for men, where the lung cancer rate is reduced. But you see that colon cancer rates are steadily decreasing for women as well, probably because of increased screening and picking up precancerous conditions. Cancer deaths, you see the steep reduction in lung cancer deaths as smoking rates reduce, but you also see the steep reduction in the green line for colon cancer deaths. This is among men, and a similar statistic for women. Just a little side note there, in the box you have pancreatic cancer, which is not doing so well. Pancreatic cancer is still a pretty bad cancer to have, can cause a lot of morbidity and mortality. So let's go to California. In 2014, the estimation for new cancers of all sites was 171,000 new cases of cancer in California, out of which about 14,000 new cases of colon cancer were expected in 2014. So we don't want any of us to be amongst that statistic. And if you go to the next slide, the number of deaths attributed to cancer in California, 58,000. Attributed to colon cancer, 5,000. So that's a sobering statistic. There are some differences in ethnicities as well as sex in terms of cancer incidence rates. For reasons that are not very clear, black males have a higher incidence, so they're more statistically more prone to get colon cancer, as compared to white males, followed by white females, and lastly black females. But if you look at the death rates, again, black males seem to have a higher incidence of or a higher statistic of colon cancer mortality as opposed to other ethnicities. But the good news is, as we compare over time, treatment seems to be improving that statistic. So to go into that a little more, if you look at colon cancer survival rates, from 2003 onwards, there again is a slight difference between the races. And then if you go to the next slide, the overall risk of developing cancer, and this is an important statistic, so I'm just going to dwell on this slide a little. All sites, the chance of developing cancer for a man is 1 in 2. It's that simple. There's a 50% chance a man is going to develop some type of cancer during his lifetime. And the risk of developing colon cancer is 1 in 20. 1 in 20 men in this room is going to get colon cancer. 1 in 7 is going to get prostate cancer, but that's for another talk on another day. If you go to women, 1 in 3 chance that any woman might get cancer during her lifetime. Risk of getting breast cancer is 1 in 8 during her lifetime. The risk of colon cancer is again about 1 in 20. So similar statistics for both males and females.